Now let's talk about GB38, Yangfu, Yang Assistance at Jing-River Point. GB38 is located fortune proximal to the highest prominence of the lateral malleolus on the anterior border of the fibula. How to find? First, locate the prominence of the lateral malleolus, and from there, measure fortune in a proximal direction. There, locate GB38 on the anterior border of the fibula, or on the lateral aspect of the lower leg. The distance between the prominence of the lateral malleolus and the popliteal crease is 16 chung. Divide this distance into quarters and locate GB38, 1/4 of the distance from the lateral malleolus. Aid, spreading hands technique or elastic tape. For orientation, the borders of the fibula are deep to the peroneus brevis muscle and are often not easily palpable. For this reason, it is suggested to palpate the anterior border of the fibula just superior to the ankle and then locate the point on an imaginary line running to the head of the fibula. Needling vertically 0.5 to 1.5 chung. Actions, indications, opens the channel, clears wind and heat. Special features, Jing-River point, far point, sedation point. Subdues liver yang, headache, pain on the outer canthus of the eye, clears heat, bitter taste, sighing, hypochondrial pain, feeling of heat. GB38 is the fire and Jing-River point of the gallbladder channel. According to the Great Compendium of Acupuncture and Moxibustion, when the gallbladder is excess, reduce GB38. The main actions of GB38 are to clear stagnation and heat from the entire course of the gallbladder channel, clear Shaoyang heat, and benefit the sinews and bones of the whole body. In the head, GB38 is an important point for one-sided headache, principally due to liver qi stagnation or uprising of liver fire or liver yang, which transmit along the gallbladder channel. In the upper part of the chest, the gallbladder channel passes anterior to the axilla. When qi and phlegm stagnate, and in some cases transform into heat, usually due to emotional causes, there may be swelling and pain of the axilla or scrofula. In the chest and lateral costal region, GB38 is indicated when qi stagnates and gives rise to pain accompanied by sighing. In the lower body, GB38 is indicated for pain extending along the gallbladder channel on the lateral side of the lower limb and the lateral malleolus. If pain in any of these regions is severe, a blue-green Qing color may be seen on the complexion. This color, frequently observed around the mouth, eyes, nose, or temples, has traditionally been linked with liver disorders, severe pain, or cold in the body. According to both the spiritual pivot and the essential questions, Taiyang is the opening, Yangming is the closing, and Shaoyang is the pivot. The Shaoyang is the pivot between the interior and the exterior, and GB38 is indicated for the classic symptoms seen when a pathogenic factor lodges in this half interior, half exterior portion. These include distinct alternating phases of chills and fever, bitter taste in the mouth, pain of the chest and lateral costal region, and sighing. Malaria, for which this point is indicated, is a classic example of Shaoyang pattern. GB38 is fire point, sedation point, Jing-River antique late summer point. This fire point brings sparkle to the wood. Consider where there are no plans for the future, where the patient cannot see clearly the way forward in their life. Useful when a person sighs a lot. This point supports our yang aspect for timidity, irritability, or where there is no sense of growth or development. For a bitter taste in the mouth, consider for chronic migraine, often used with liver too. As a fire and sedation point on the gallbladder, this point clears liver gallbladder fire and subdues liver yang. This makes it a useful distal point for chronic migraine, irascibility, red eyes, bitter taste in the mouth, constipation, and gastric disturbances that involve heat. It can also be used when there is stagnation with headaches, oppressive feeling in the chest, and much sighing. As with all Jing-River points, it can treat fevers, and particularly as the fire point on Shaoyang, gallbladder, and three-heater in the 6 divisions of yin-yang, when a pathogen is stuck half interior and half exterior with alternate chills and fever, bitter taste in the mouth.